Hello, and welcome to Dr. Sila Biolabs. Have you ever wondered how a small cavity can eventually lead to severe tooth pain, swelling, and a serious dental abscess?
Deep within every tooth lies a complex living system of nerves, blood vessels, and root canals that can become infected.
By rotating the holographic model, we can examine how the infection progresses deep into the root canal system, affecting the red blood vessels and blue nerves. In the Dentistry, we will take an extraordinary journey inside a lower molar tooth using advanced medical animation. Together, we will explore how tooth decay develops, how infection spreads into the pulp, how an abscess forms around the root.
The decay progresses rapidly, leading to infection deep within the pulp and an abscess at the root. However,
and how modern root canal treatment can eliminate infection while preserving the natural tooth. At Dr. Sila Biolabs, our mission is to transform complex medical and biological science for students, healthcare professionals, and lifelong learners around the world. Now, let us begin our journey into the hidden world inside a tooth.
And discover the science behind root canal treatment and tooth abscesses.
Deep inside a tooth, a hidden infection can silently grow for months or even years. Deep within the pulp, life thrives. But on the surface, a menacing threat.
What begins as a small cavity may eventually reach the living tissue inside the tooth, causing severe pain and dangerous complications. As bacteria invade deeper and deeper, an abscess can form around the root, damaging the surrounding bone and tissues.
This dark area here indicates the infection. It's an abscess, but we caught it early.
So you can fix it.
The pulp chamber, seen here glowing with a gentle warmth, is the living core of the tooth, containing vital tissue and nerves.
A root canal is not a treatment. It is a natural part of every tooth. Inside each tooth lies a soft tissue called the pulp,
which contains blood vessels, nerves, and connective tissue. Extending from this pulp chamber are narrow pathways known as root canals.
A fly-through reveals the complex anatomy of the root canal, showing the delicate pulp tissue and nerve fibers housed within the dentin walls.
These canals travel through the roots of the tooth and connect to the surrounding tissues through tiny openings at the root tips. The cross-section reveals the tooth's healthy anatomy, the protective enamel, the supportive dentin, and the vital pulp chamber. When bacteria invade the pulp and travel through the root canals, they can escape through the root tip and infect the surrounding tissues.
The infection reaches a critical turning point as the bacteria breach the apical foramen, spilling into the jawbone. The body's immune system responds by sending white blood cells to fight the infection. As bacteria, immune cells, and damaged tissue accumulate, a pocket of pus begins to form. This pocket is known as a dental abscess. Over time, the abscess may enlarge, causing swelling,
Without treatment, the infection can continue spreading and may lead to serious complications. This is why early diagnosis and treatment are so important.
The subject of our study is the lower first molar, a critical component of the masticatory system. To understand tooth infections and root canal treatment, we first need to understand the anatomy of a lower molar.
The outermost layer is enamel, the hardest substance in the human body.
Beneath the enamel lies dentin, a mineralized tissue filled with microscopic tubules. At the center of the tooth is the pulp chamber, which contains nerves, blood vessels, and connective tissue.
Deep inside the pulp chamber, we find the living tissue. The intricate network of blood vessels provides nourishment. Extending from the pulp chamber are root canals that travel through the roots to tiny openings at the root tips, known as the apices.
The roots are anchored within the jawbone by the periodontal ligament,
while healthy gum tissue surrounds and protects the tooth.
Together, these structures allow the tooth to function normally while remaining securely attached within the mouth.
Most tooth infections begin with a cavity. After eating foods rich in sugar and carbohydrates, bacteria naturally present in the mouth feed on these food particles.
As they metabolize sugar, they produce acids that accumulate within a sticky layer called dental plaque. At first, the damage may appear as a small white spot, but repeated acid attacks weaken the enamel further.
This opening allows bacteria to penetrate deeper into the tooth, marking the beginning of tooth decay.
Although cavities often start painlessly, they can progress steadily if left untreated, eventually leading to serious infection.
When a cavity breaks through the enamel and reaches the dentin, the disease progresses much more rapidly.
Unlike enamel, dentin is softer and contains thousands of microscopic channels called dentinal tubules.
These tiny pathways allow bacteria, toxins, and external stimuli to move closer to the pulp.
As decay advances through dentin, the tooth often becomes sensitive to cold, heat, sweets, or pressure.
The bacteria continue spreading inward, destroying tooth structure and moving ever closer to the living tissue at the center of the tooth.
However, the pulp is trapped within the hard walls of the tooth and has very little room to expand. As swelling increases, This often causes severe pain, especially in response to hot or cold foods and drinks. In many cases, the pain may become spontaneous and intense, often worsening at night.
This condition is known as irreversible pulpitis, and without treatment, the pulp tissue may eventually die. If the infection inside the pulp is not treated, the increasing pressure and inflammation can eventually cut off the blood supply to the tissue.
Without oxygen and nutrients, the pulp begins to die. This process is known as pulp necrosis.
As the nerve tissue degenerates, the severe pain that was once present may suddenly decrease or disappear.
Although this may seem like an improvement, the infection is actually becoming more dangerous.
The dead pulp provides an ideal environment for bacteria to multiply and spread throughout the root canal system.
With no living tissue left to resist the infection, bacteria continue moving toward the root tips. The infection breaches the root apex
and eventually escape into the surrounding bone and tissues. This marks the beginning of a much more serious stage of disease that green-yellow biofilm swarms aggressively, breaching the confines of the root apex. The bacteria breach the root apex, spilling into the sterile jawbone and triggering an immediate inflammatory response. Once bacteria escape through the root tip of a tooth with necrotic pulp, the infection spreads into the tissues surrounding the root.
The immune system quickly responds by sending white blood cells to the area in an attempt to contain the infection.
During this battle, large numbers of bacteria, immune cells, and damaged tissue accumulate together.
This material forms a thick fluid known as pus.
As a tooth abscess develops, the symptoms often become increasingly noticeable.
One of the most common signs is a severe throbbing toothache that may radiate into the jaw, ear, or surrounding areas. Many patients experience sharp pain when biting or chewing because pressure on the tooth compresses the inflamed tissues around the root.
I know you're in a lot of pain right now, but we're gonna take great care of you. We'll start by examining the area around this tooth.
When a patient presents with symptoms of a tooth abscess, a thorough dental examination is the first step toward diagnosis.
The dentist begins by carefully examining the affected tooth and surrounding tissues.
Okay, we're looking at the lower first molar now. I'm just using the Explorer to check the grooves for any decay.
Signs such as deep decay, gum swelling, or drainage may provide important clues about the underlying problem.
All right, the mirror shows a deep cavity right here. And the surrounding gum tissue, as you can see, is quite inflamed.
A percussion test checks for pain when the tooth is tapped.
I know that hurts, but it tells us exactly what's going on. The inflammation is deep inside the pulp.
While temperature tests assess the response of the nerve tissue.
By combining the patient's symptoms with the clinical examination, the dentist can determine whether further investigation is needed.
So based on the x-rays and the charting here on the tablet, it looks like we're dealing with an abscess at the root of this molar. But it is treatable.
This digital x-ray will give us a clear view of the infection beneath the tooth. It's a quick process.
All right, whatever you recommend, Doc.
While a clinical examination provides valuable information, dental x-rays are essential for confirming the diagnosis and planning treatment.
X-rays allow the dentist to see structures hidden beneath the gums and inside the jawbone.
We're just placing the sensor now. Nice and easy. Go ahead and close your teeth together gently and try to stay perfectly still.
In teeth affected by pulp necrosis and abscess formation, a dark area often appears around the root tip.
This dark area clearly indicates an infection at the tip of the root. This confirms the need for a root canal procedure to resolve the issue.
The radiograph also reveals the shape and length of the roots, helping the dentist understand the anatomy of the root canal system.
By combining the clinical findings with radiographic evidence, the source of the infection can be accurately identified. In many cases, root canal treatment offers an opportunity to remove the infection, preserve the natural tooth, and allow the surrounding tissues to heal.
Proper treatment planning is a critical step in achieving a successful outcome.
X-rays are essential in diagnosing a tooth abscess and planning the appropriate root canal treatment.
We have clear apical radiolucency here.
Confirms the diagnosis, doctor.
Indeed. Let's begin the setup. As you can see on the x-ray, this lower molar has an infection at the root. We need to do a root canal to save the tooth.
This procedure should alleviate the pain you've been experiencing. We'll start with the local anesthetic now that you understand the process.
Before root canal treatment can begin, the tooth must be prepared carefully.
The first step is the administration of local anesthesia, which numbs the tooth and surrounding tissues to ensure the procedure is comfortable for the patient.
We're ready for the anesthetic now. You're doing great, just relax.
The anesthetic agent is introduced, effectively blocking the pain signals traveling along the nerve pathway before they can reach the brain.
Once the tooth has been anesthetized and isolated, the next step is creating an access opening.
The first critical step is creating the access opening, allowing us to reach the infected area deep within the tooth structure.
Using a precision dental handpiece, the dentist carefully removes decayed tooth structure and creates an opening through the crown of the tooth. This opening provides direct access to the pulp chamber, where infected or necrotic tissue is located.
After the chamber is exposed, debris and damaged tissue are removed to improve visibility.
The dentist then identifies the entrances to the root canals. Magnification and illumination may be used to locate these tiny openings accurately.
To ensure a precise pathway, the Endodontic Explorer gently glides across the chamber floor. The glowing blue overlay. A properly designed access cavity is essential because it allows instruments to reach the full length of the canals safely and efficiently. Access opening, the gateway to root canal treatment. With the canals located and accessible, the cleaning and disinfection phase of root canal treatment can begin.
Using a combination of stainless steel hand files and nickel titanium rotary instruments, we meticulously clean and shape the complex anatomy.
Cleaning the root canal system is critical. A stainless steel hand file is used to carefully explore the mesiobuccal canal. After locating the root canals, the next step is cleaning and shaping the canal system. Small instruments called endodontic files are introduced into the canals to remove infected pulp tissue, bacteria, and debris. The dentist first determines the exact working length of each canal to ensure treatment reaches the root tip without extending beyond it.
Modern root canal therapy often uses flexible nickel titanium rotary instruments that can safely navigate the natural curves of the canals.
As these instruments rotate, they enlarge and shape the canals, creating a smooth pathway for effective disinfection and filling.
By the end of the shaping phase, the canals are cleaner, more accessible, and ready for thorough irrigation and disinfection.
Following irrigation, the shaping phase is complete. The canals are now sterilized and smoothly tapered, ensuring a successful obturation. Cleaning and shaping alone cannot completely eliminate infection from the root canal system. For this reason, thorough disinfection is a critical step in root canal treatment. Irrigating solutions are used to flush the canals and destroy bacteria that may remain after instrumentation.
One of the most commonly used irrigants is sodium hypochlorite, which is highly effective at dissolving dead tissue and killing microorganisms.
That's. Modern techniques may also use ultrasonic activation to enhance the movement of irrigants, allowing them to reach tiny.
As bacterial biofilms are disrupted and debris are removed, the canal system becomes progressively cleaner. Multiple cycles of irrigation help reduce the bacterial population to a level that the body can successfully manage. Once the canals are thoroughly disinfected and dried, the tooth is ready for the next stage of treatment.
Once the root canals have been thoroughly cleaned, shaped, and disinfected, they must be sealed to prevent future bacterial contamination.
This stage of treatment is known as obturation. With the canals fully prepared, we begin the obturation phase, carefully selecting the sterile gutta percha points for a three-dimensional seal. A biocompatible material called gutta percha is carefully fitted into each prepared canal. As the master cone is inserted, it must fit snugly against the prepared dentin, ensuring a perfect seal both at the apex and the coronal opening. An endodontic sealer is also applied to fill microscopic spaces and irregularities that may remain along the canal walls. The animation demonstrates the sealer flowing into the lateral canals. This is followed by the compaction of the master and
Together, the gutta percha and sealer create a three-dimensional seal throughout the root canal system.
After all canals have been completely filled, the dentist verifies the quality of the seal using a radiograph. As you can see, the obturation material extends precisely to the apex of each root, ensuring a complete seal with no voids. With the infection removed and the canal sealed, the tooth is now ready for its final restoration, which will restore strength. Here we see the completed root canal therapy on the lower first molar, with the 3 canals sealed with gutta percha.
After root canal treatment is completed, The tooth must be restored to regain its strength and function.
Teeth that have undergone root canal therapy often have significant loss of tooth structure due to decay, previous restoration.
As a result, they may be more susceptible to fracture under normal chewing forces.
To reinforce the tooth, a core buildup is often placed to replace missing internal structure.
In many cases, especially for molars, a dental crown is recommended to provide long-term protection.
The intraoral scanner captures thousands of data points, creating a precise digital impression of the prepared tooth. The crown covers the entire visible portion of the tooth, distributing chewing forces evenly and reducing the risk of fracture. The core buildup reconstructs the tooth structure, allowing the final crown to provide complete protection and a natural look.
Once the crown is securely cemented into place, the treated tooth can function normally again. This final restoration plays a vital.
We begin with a detailed view of the restored molar. The root canals are perfectly sealed with gutta percha.
Although the root canal procedure itself may be completed in a single appointment or over several visits, healing continues long after treatment is finished.
Once the infected tissue and bacteria have been removed and the canals have been sealed, the body can begin repairing the damage caused by the infection.
Inflammation around the root tip gradually decreases, and the abscess begins to resolve.
Specialized cells remove damaged tissue while new healthy tissue develops in its place.
Under polarized light, the flawless integration of the restoration becomes clear. This is the definition of a healthy, protected smile.
We have followed the journey of a lower molar from the earliest stages of tooth decay to the development of a painful abscess.
While modern dentistry can often save infected teeth, prevention remains the best approach.
Daily brushing, flossing, fluoride use.
And regular dental checkups can help stop cavities before they become serious infections.
With proper oral hygiene and routine professional care, most dental infections can be prevented, helping patients maintain healthy smiles for a lifetime.
Thank you for watching this educational presentation by Dr. Sila Biolabs.
Welcome to the lab. Today, we'll explore the root canal process using this advanced holographic visualization. Congratulations. You have now completed our journey through the science of root canal treatment and tooth abscesses. Today, we explored how a healthy lower molar can gradually become damaged by tooth decay. We also discovered how this infection can skip. Most importantly, we learned that root canal treatment is designed to save a natural tooth.
By carefully removing infected tissue, disinfecting the root canal system, sealing the canals, and restoring the tooth.
A tooth abscess is not simply a toothache. It is a bacterial infection that requires professional diagnosis and treatment.
We hope this video has helped you better understand the biology of ToothInfection, the formation of abscesses.
If you found this educational documentary helpful, please support our mission
by liking this video, sharing it with others, and thank you for watching, and we look forward to seeing you in our next scientific journey. Stay curious, stay informed, and keep smiling. As you can see, the procedure successfully removes the infection, restoring the tooth to full health.